So yeah, thank you everyone for your presentations. I've really enjoyed learning about your projects, and I'm excited to share about mine, which, as mentioned, involved exploring protective, non-dietary aspects of healthy eating among school-age children in BC. I'm grateful to be joining you today from and to have completed my practicum on the traditional, unceded, and shared homelands of the Coast Salish peoples, including the Squamish, Tsleil-Waututh, and Musqueam nations. As a white occupier of European ancestry, I acknowledge that I have and continue to benefit from colonialism. However, I am committed to using my unearned privilege to confront, unlearn, and disrupt colonial patterns. I recognize how my positionality can result in inherent biases that can shape my perspectives, but I strive to approach every interaction with an open mind to the experience and knowledge of others. To ground us today, I wanted to reflect on that notion of openness. It is reflected in one of the 6 Coast Salish teachings that were gifted to the Provincial Health Services Authority from knowledge keeper Shane Point, Walks, Hooks, in Shqualowin. This means to open your hearts and your minds, and reminds us that when we are open, we're able to do our best. So in this presentation, I'm going to first start with some background on my practicum site and then discuss the project and its introduction, methods, findings, reflections, some strengths and challenges of it, and implications for public health practice. My placement was with the BC CDC, which is a program of the Provincial Health Services Authority. Specifically, I worked with the Food Security and Healthy Eating team on the Population and Public Health Prevention and Health Promotion service line. My project, however, related more to the scope of the Healthy Eating team, who supports the development of safer, healthier, and more equitable policies, programs, and initiatives related to food. So much of the food programming and policy in Canada is based on recommendations that emphasize intake of vegetables, fruits, whole grains, and protein foods, referred to from here on as Eurocentric indicators of healthy eating. And while these foods can aid in reducing the incidence of non-communicable disease later in life, focusing solely on nutrient intake to define what it means to eat well or be healthy fails to consider how one's context and other social determinants of health, such as household income level, can impact dietary choices. As a result, population-level nutritional health, mental well-being, and equity can decline. For this reason, I was prompted to consider the limitations of this dominant perspective. I grounded my work in the socio-ecological model, which is an approach to health promotion and equity that focuses on the connections between an individual and their environment. This helps to define characteristics that increase positive outcomes, known as protective factors. So therefore, I was asked to explore protective non-dietary aspects of healthy eating. According to my practicum site, non-dietary aspects of healthy eating relate to the contextual factors such as one's environment, culture, and social connections. However, these can be overlooked when Eurocentric indicators of healthy eating are emphasized. We sought to understand how these protective aspects can surface at the individual level and impact dietary choices. Specifically, the research question that guided my work is, what are protective non-dietary aspects of healthy eating among school-age children in BC? So to answer this research question, it was important that I consider current practices and perspectives from a diversity of population groups, which is a key characteristic of evidence-based public health. For that reason, I chose to conduct an environmental scan to explore if partners perceive any limitations related to the use of Eurocentric indicators of healthy eating for school-age children, and if they would be open to additionally considering protective non-dietary aspects when it comes to defining what it means to eat well and be healthy. The environmental scan consisted of a literature review, interviews, and a thematic analysis. In the literature review, I did a high-level database search that was supplemented by materials assigned throughout the MPH program, gray literature from Google, and materials shared by key informants. This helped to deepen my understanding of the topic and inform the interview component of the environmental scan. Then I held a total of 11 virtual interviews with partners across BC, including regional health authority dietitians, dietetics students, and school-age nutrition program leaders. Each interview covered the same 6 questions, but participants could skip or add additional insights at any time. When each interview was completed, I then conducted a thematic analysis that went question by question to inductively code answers. This allowed me to pull themes out from each participant's answer and connect them to ones that recurred across interviews. The initial analysis resulted in a total of 49 themes across the 6 questions. However, I focused my analysis on the most common theme or themes that showed up in each. I will now discuss those themes and share some relevant quotes from the interviews. So the first question asked the interviewee about their work and positionality. The most common theme that emerged here was their role and scope of work. Although not the specific focus of this review, most spoke to their involvement in school meal programs and how they use their role to help students foster positive relationships with food. A secondary theme is the recognition of the interviewee's positionality, the impact of colonialism on how healthy eating is defined, and how settler accountability is needed to create culturally safer spaces where diverse forms of knowledge and relationships with food are respected. This is exemplified with insights such as we need to decolonize health practices. The second question asked the interviewee what they consider to be protective non-dietary aspects of healthy eating and if they felt it would be beneficial to refer to them. The primary theme that emerged here is that participants view the environment to be a protective aspect. They share that when environments are trauma-informed, psychologically safer, facilitate connection to food, and allow a child to feel in control of their eating choices, positive eating behaviors and nutrition outcomes are likely. Across interviews, there is also consistent agreement that referring to protective non-dietary aspects is beneficial because of how they consider the broader contextual influences. When participants, for example, participants shared that when social and cultural factors are considered, healthier relationships with food is possible. This is exemplified with insights such as eating can build relationships. The third question asked the interviewee if they saw any benefits or limitations related to Eurocentric indicators of healthy eating. The primary theme here that emerged was the limitations of their use, as participants felt they create a narrow perspective of what it means for school-aged children to eat well and be healthy, and fail to tell the story behind food choices. This is reflected with insights such as eating well is complex. However, it was discussed that tools that reflect Eurocentric nutritional guidelines, such as Canada's Food Guide, do include a variety of foods within each food group. This can be a valuable teaching tool as long as there's space for children to incorporate their own preferences. The fourth question asked if there's currently any reference to indicators of healthy eating in the interviewee's work. The primary theme that emerged is that systematic measurement tools are lacking, so observational evidence is often used to monitor protective non-dietary aspects. For example, participants shared that positive eating experiences, such as peer involvement, are observed to be related to several healthier eating behaviors. And as introduced with question 4, the primary theme that emerged when asked about gaps or opportunities that exist in identifying protective non-dietary influences of healthy eating, it was shared that there is a lack of available tools to do so. Participants suggest this could be because non-dietary aspects are subjective and difficult to define. However, this was also framed as an opportunity to build relationships with partners to develop more qualitative approaches that holistically illustrate those protective aspects. This is reflected in insights such as collaboration will help to understand the complexity. And lastly, when asked about acting on these gaps and opportunities, a common theme that emerged is the gaps in data collection methods that have prevented identifying and measuring protective non-dietary aspects of healthy eating. For example, colonialism has impacted what perspectives are prioritized and valued in research. Therefore, systemic biases exist in funding and decision-making power that then perpetuate these Eurocentric nutritional recommendations. As suggested by one interviewee, this can misrepresent the reality behind food choices and eating behaviors. An important reflection in all of this is that across interview questions and participants, there was acknowledged of the impact of colonialism that it has on food systems, research priorities, and policymaking. Interview participants suggested that to mitigate this, settler accountability is needed to recognize the impact that inherent biases have on program and policy decisions. This can enable a two-eyed seeing approach that gives equal value to Indigenous and Western ways of knowing when it comes to engaging with food. So approaching this work from within the BC CDC is a key strength as it grounded the project in organizational values of reconciliation, anti-racism, cultural safety, and equity. This encouraged the inclusion of diverse, evidence-based worldviews when possible and will help to ensure that the work continues in a good way. However, given the time constraints of the practicum, the interview component relied primarily on convenient sampling of participants. This prevented many individuals and groups, including those who are most equity denied, from participating in the environmental scan. Therefore, I want to be intentional about how this work can be integrated into public health practice. Because gaps and challenges will always exist, ongoing evaluation must occur to identify and address new challenges as they arise. However, based on the currently available information, implications for public health practice can be expressed in terms of short, medium, and long-term goals. In the short term, we hope to share findings amongst health authorities, provincial ministries, school districts, community-level organizations, and data collection partners. In the medium term, we hope to embed the findings into existing data collection to fill gaps in data that's already collected, rather than developing and disseminating a whole new instrument. And lastly, we have two goals for the long term. One is to influence policy and program decisions that are currently rooted in Eurocentric indicators of healthy eating, such as Canada's National School Food Policy. And the second goal is actually what prompted this whole project, and that is to develop summary indicators that will help to build an evidence base of comparison data to, in the future, better understand gaps, explore new approaches, and improve existing policy. That is everything. Thank you so much, and looking forward to hearing some questions or comments.